Let's do it. All right, good morning, everybody. How's everyone doing today? Excellent. I think also too, right as we were getting kicked off here, we have 2, 3, 4, 5, 6, 7 folks. So we're ready to go. All righty. Okay, welcome everyone. Good morning. Today is June 26th. It's our June Coordinated Entry Committee meeting. And so as always, to get us started here, I'll start by reading our theory of change and doing our land acknowledgement. KCRHA theory of change is that if we create a homelessness response system that centers the voices of people with lived experience of homelessness, then we can focus on responding to needs and eliminating inequities to end homelessness. We acknowledge that King County is located on the unceded traditional land of the Coast Salish peoples. We honor this land and its people past and present, and we are committed to directing funding and resources to organizations led by and in support of Native and Indigenous people. All right, wonderful. I think, Catherine, we're ready to take our roll call here this morning.
Devin is not here, but has submitted a proxy.
Yes.
Cherry Ann is here. Noah.
Here.
Eddie.
Present.
Martha.
Present.
Portia. Patricia Sam. Elliot.
Present.
Kelsey. Is present.
Present.
Zsa Zsa. Sherry. Finn.
Present.
And Mustafa.
Present.
Awesome.
We have 9 present and 2 absent. You have met quorum.
Wonderful. Thanks, Catherine. Hi, everyone. Welcome. Something that I didn't put on the agenda, but I should have, is just taking a moment to introduce and welcome our new committee members that we voted in during last month's meeting. So congratulations to Mustafa and to Finn. Welcome. Thanks for joining us at your first Coordinated Entry Committee meeting today. I suppose something that we should do very quickly is just if you both want to introduce yourselves and say hi. Maybe we can do name, pronouns, what organization you're joining us from, or from where in the community you join us from, and one thing you're looking forward to, as a new member of our CEC here. So let's go in alphabetical order. Finn, we'll start with you.
Hi everyone, my name is Finn. I use they them pronouns, and I am the Housing Coordination Supervisor at Evergreen Treatment Services REACH. And one thing I'm looking forward to is just listening and learning on what direction y'all are wanting to take coordinated entry and being involved in that process. Thanks.
Thanks, Finn. Yeah, we're really glad to have you here with us. Mustafa.
Hey, this is Mustafa. Thank you for having me. He, him, and I'm the King County Health Board member and Behavioral Health Board member. And I am here just to listen and to grow up and to support the team and to work as one team.
Excellent. Yeah, thank you so much, Mustafa. It's great to have you here.
Thank you so much.
All righty. The first thing that we had on our agenda this morning is I wanted to give you all a presentation about different vulnerability assessment tools that are kind of used here locally in Seattle and King County, and then also nationally throughout the rest of the country, different like alternatives to the VI SPDAT assessment. And so I'm gonna pull up my slides. All right, maybe just a quick thumbs up for folks to confirm that you all can see my screen here. Great, thank you. Okay, awesome. So coordinated entry assessments. A little bit of context, like I was just saying, here in Seattle and King County, we have not used the VI SPDAT for prioritization and coordinated entry since October of 2020. Our community was actually one of the first kind of nationally to provide feedback and data indicating that the VI SPDAT wasn't maybe the greatest tool for prioritization and coordinated entry. It has evasive questions and perpetuates racial inequity. That was something that here in this community we found was that it was perpetuating higher rates of folks who identified as white getting placed to permanent supportive housing. Even though we know that in our region, Black and Indigenous people of color are more disproportionately represented in our homeless population. After removing VI SPDAT questions from our assessment tools to prioritize folks, we used what was called COVID prioritization. So this was a matrix of mostly medical administrative data combined with HMIS data to prioritize folks for kind of who is most likely to die while experiencing homelessness due to the coronavirus pandemic. In April 2023, the agreements that we had with our different partners ended, and we didn't have access to the data we needed to kind of implement that matrix for COVID prioritization. And we adopted what was an interim measure for prioritization hinging on the self-reported date for the length of current episode of homelessness. If a match is not able to be found through that metric, we look at survivor status, whether the household is fleeing or attempting to flee. And then lastly, we look at whether or not the household is sheltered. So if they're unsheltered, then the prioritization goes to that household. But that only happens third in a ranking list. So the first point being just the self-reported length of time in the current episode of homelessness. That's where we are today. And I think, many of you here, and myself included, have, different opinions about this. And certainly we've had, 2 years now to really see how this has been playing out in our coordinated entry system. It lacks an assessment that aligns with prioritization. So we're really not using an assessment to prioritize folks' needs right now. And also that key metric point, just length of time in the current episode of homelessness, lacks, equity. It's not using equity as any type of, indicator. It's self-reported data, which makes room for lots of problems. And it doesn't represent other well-known risk factors for chronic homelessness like age, race and ethnicity, gender identity, medical or behavioral issues. And it also doesn't consider other, key factors for vulnerability like survivor status when it comes to intimate partner violence or domestic violence, or also pregnancy status. Some of the goals and priorities that we, the coordinated entry team, have are short-term to utilize an assessment for prioritization rather than relying on self-reported length of time. Another goal that we have is working to foster the different elements of the coordinated entry system to kind of work better together so that there is more of this, throughput kind of idea where folks are experiencing unsheltered homelessness or folks who are living in what are meant to be, emergency short-term shelter beds, transitioning to permanent supportive housing. And then longer term, we would really love to regain the ability to incorporate medical administrative data into prioritizing folks' needs here in our community. Alex Ibrahimi, my predecessor, used to talk about this a lot, that it's less invasive. You know, if you're able to use medical administrative data, then you don't need, you know, reassessing folks or using an assessment is by nature kind of more invasive. You're needing to ask folks intimate details about some of the most difficult and challenging elements and points of their lives. And using medical administrative data is much less of that kind of re-traumatizing burden, both on the people experiencing homelessness and also those who are conducting the assessments too. Also, medical administrative data is better quality than HMIS. This does, you know, bring me to talk about vulnerability assessments. There's a number of them out there. You know, of course, here in our local community, we have the Downtown Emergency Service Center Vulnerability Assessment Tool. It was created here locally by DESC. And, you know, it's a full assessment. And then it also comes with several kind of like miniature or different variations used for kind of different tools, whether it's triaging folks for permanent supportive housing. We've used it here in coordinated entry to not, I don't believe, to prioritize folks for housing resources, but rather to tie break when numerous people in case conferencing are brought forth to be considered for the same resource. You know, we've used miniature versions of the vulnerability assessment tool to tie break those households. I believe right now there are like emergency shelters or emergency housing, hotel-based shelter programs that DESC uses a variation of the miniature of that tool to triage referrals. There is what is called the matching to appropriate placement assessment, something that's been created by a partnership with Pathways Community Network Institute, as well as the Municipal Information Systems, you know, companies. They have this alternative assessment called the MAP. I have actually reached out to them to kind of see if they would be able to share PDF copies or samples of this assessment. I wasn't able to find it kind of through Google search. And then same with the Southern Nevada Community Housing Assessment Tool, CHAT. So there are other alternatives out there beyond the VI SPDAD to incorporate into, you know, service matching and prioritizing households and coordinated entry systems. Of course, we here in Seattle and King County at the coordinated entry system have the housing needs form. This is not an assessment, it's a needs form. And my memory of its original, and actually I was having a conversation with Eddie just last week, and he kind of helped remind me and reground me in what the creation of the housing needs form was about. It really came from this idea that if we are able to create by name lists of folks who are enrolled in coordinated entry and kind of use the housing needs form to organize those folks around kind of like barriers, location preferences, and program type preferences, and, you know, triage for things kind of like, does this household need an ADA accessible unit that is constructed for folks living in wheelchairs? You know, if we're able to have a by name list of all the folks enrolled in the coordinated entry system in King County, and then we can filter and say, these are those who, according to their housing needs form, are in need of a wheelchair. That's kind of more what the housing needs form's original conception was for. Wasn't to do a fulsome assessment of the household's needs and risk living in the shelter or on the streets. So as I mentioned before, there are a couple different mini VAT variations. DESC uses it as its Star Center referral form, which is a new emergency housing or emergency shelter program that they've opened up in downtown Seattle. There's the emergency housing referral form, and there's also a variation that's used as their service matching tool for when a referral is sent from coordinated entry to DESC permanent supportive housing. This is a form that the referring housing navigator receives to complete with the household in order to triage and really do that final check for you know, final eligibility for DESC's programs. Something that I wanted to talk with you all about today is an idea that has come from the community to potentially use a assessment tool to pilot with folks staying in shelters, some of these short-term emergency housing programs. There in Seattle, we have some run by Catholic Community Services as well as the Downtown Emergency Service Center. And the idea is really to, with these programs, using variations of an assessment tool, they are using the mini-VAT to triage referrals from the community. And so the idea would be to use a tool to also pair this with not just the folks going into the emergency housing programs, but coming out of the emergency housing programs and transitioning into permanent supportive housing. So we would train DESC and Catholic Community or Coordinated Care Agency or CCS assessors to use the tool, assess coordinated entry enrolled households at DESC and CCA shelter programs, and then use the tool to prioritize and match households to DESC and CCA PSH units. We would do this for a period of time, and then after we're able to evaluate and bring lessons learned back here to this committee, we can discuss whether or not we'd like to implement something like this across the larger system. Obviously, right now, like I mentioned, for referrals from the community into these CCA and DESC shelter programs, they're using a variation of the mini-VAT assessment for referrals to the STAR and as well, I believe, to CCA shelters too, the Bridge Shelter at Junction Point, that referrals from the community, whether they're from like the Unified Care Team or the City of Seattle contracted outreach providers with their regional kind of implementation plan, are conducting a form very similar to the STAR Center referral form to triage and accept referrals into the CCA programs. There's also the potential for this committee to discuss the merits or, kind of review and look at other assessments like the MAP and chat as well, to talk about implementation in our community. I think some limitations and important things to consider would be that prioritization and service match are not necessarily one and the same. We know, and after almost 10 years of case conferencing through the coordinated entry system in our community, we know that there's going to be a need to not only prioritize households for resources in our system, but also tie break when there are multiple nominations for one resource, because regardless of whether we've been in a in-person, weekly case conferencing format or this kind of current, more digital, smart sheet, daily, like dynamic case conferencing format, we receive often multiple resources for multiple nominations for one resource. So prioritizing a household, understanding and service matching what their needs are for a housing intervention, and then tie breaking the households that are nominated are really kind of three separate things. And so while an assessment can be helpful in determining of the folks enrolled in coordinated entry, who are those that we should prioritize to have access to resources, and tie breaking and service matching are just different. That is all that I have. I think time. Okay, cool. Kelsey, I see that your hand's up, and I believe we do have time for a couple of questions. Yeah, so Kelsey, please. Oh.
I unmuted myself and muted myself. Thanks. So my one question, well, maybe not my one question. One question I have, given that we have had a focus on folks who have been unsheltered, I'm curious whether or not anything that we are piloting would go beyond just folks in shelters, and whether or not the incorporation of those who are being outreached to be included within this. I think that is a way to ensure that we are, you know, meeting our goal of reducing unsheltered homelessness, as well as really living like housing first values of getting folks directly into housing versus, unsheltered to shelter to housing. So I wanted to throw that out there to the group of bringing that unsheltered population focus into some sort of a pilot.
Yeah, thanks, Kelsey. I think you're absolutely right. And right, that's also been a question and yeah, area for coordinated entry for a long time to kind of wrestle with. So yeah, thanks for raising that. Eddie.
Hey, so questions about the tools that you mentioned. I mean, I know for the one of them that you reached out and you hadn't heard back from, but do you have any like data around like the effectiveness of those tools or like how it is like even though you may not have the tool itself, have you seen any reports around data that has come out from using those tools?
Not yet, but I look forward to kind of deepening like the research and kind of investigation to bring more to this group to talk about. There's not a whole heck of a lot out there to kind of sink in and I need to kind of connect with some of the local governments and agencies that are making these things too, to kind of even get copies of them and look at them. But I look forward to doing more of that and bringing it to this group for more fulsome discussion. Finn.
Hello, I have two questions. And please feel free to cut me off if this is stuff that you guys have already discussed in the past. Kind of to echo what Kelsey was saying, I'm also wondering about how this prioritization pilot would work and what the equity would look like for making sure, like how those resources would be set aside for this population without affecting the rest of the population who is still going with the old prioritization system and making sure that folks are still being housed regardless of which they're using. My other question would be, at least with DESC's tools, we use that quite a bit here at Reach, and those questions do, get us the highest needs with like mental health and behavioral health and medical and all of those things, but that isn't the whole inventory and coordinated entry. There are quite a few organizations and units that are not set up to support folks with high mental health and behavioral needs. So will there be any sort of like way to pair the appropriate folks? Because I know we had that with VISPEDAT. We had a priority pool, but then we're not able to match those folks with the lower support units.
Yeah, Finn, thanks for that. That's a great question. I'm gonna lead with kind of talking to the second one. Yeah, I mean, I think what you're pointing at raises at what we would call like banded scoring. And I think that even with kind of, I mean, also too, I was a VAT assessor at DESC and I did work at DESC. So I'm just gonna like name and claim my familiarity with the tool and all that. But I think that there is still room for like banded scoring with using the VAT assessment or even the mini VAT assessment. Like, and I think too, what I really look forward to talking with this group about is in the future, having those conversations about those different kind of like tiers, if you will, of service match, whether it's rapid rehousing or PSH units that don't have the most intensive and robust resources to support the highest needs individuals in our communities. I think that there are in that conversation, there is room to discuss kind of how different assessment scores kind of align or band with those different service match types. Jeff.
Thanks, Tom. I missed the intros around. My name is Jeff Sims. I use he, him pronouns. I work with Tom at KCRHA. I'm the Senior Director for Policy. I just want to make sure, Tom, and this kind of builds on Kelsey's question, that we're clear about what you're proposing. If I understood it correctly, what you're saying, the proposal, I think it's your next slide even. There you go. That is not that we would only be assessing people in shelters, but rather that the pilot you're putting out there would be, let's identify a tool and test using that for placement into a set of PSH units. So it could be unsheltered or sheltered. It's just that's the tool that we'd be working with as the tiebreaker and kind of testing that as a match. And I just want to make sure that was accurate, and if it is accurate, that everybody was on the same page.
Can you repeat the core meat of that again, Jeff?
Yeah, I understood Kelsey's question as, are we going to do this for people that are not sheltered?
Yep.
And I took that your pilot proposal as being, this would be a test of using a tool for
Right.
filling certain PSH units.
Yes.
So that's not limited to any specific shelter filling them. You don't even have to be in a shelter if it's being done. It's really the utilize this tool to fill certain PSH units, regardless of what circumstance you're coming from. And I want to make sure if that's accurate about what you're describing, and that everybody also is clear about that as being the case.
Yes, I think there's certainly room to incorporate elements of how to accomplish assessing folks who are also unsheltered, in addition to those who are staying at the programs. Noah.
Yeah, thanks. And wave at me. My connection's been really goofy. If I cut out. So yeah, thanks for proposing this. I am super on board with DSC playing a role here to get at kind of, I think, Kelsey and Jeff and Finn's questions, which I think are all really good considerations. This idea around like piloting it at some units of PSH at some locations, I am super excited about. I mean, we developed the VAT tool at DSC a long time ago to identify our priority population for our programming. And so, I'm definitely biased towards the VAT, and I'm not, married to that as the tool by any stretch of the imagination. I will say on the question around research, it is researched and vetted and validated as a tool. There actually is a decent amount of VAT research out there. It's dated, but it's out there from our community and actually others around the globe, actually, that we could take a look at. But that's not the point I want to make. The thing that I'm seeing with the DSC PSH portfolio, so not talking about our shelters or our outreach teams, definitely there's issues there about those folks getting through coordinated entry and into PSH, which has been a real struggle for a real long time. We're seeing a really high percentage of people from coordinated entry turning down our PSH units, to the tune of like 60% at some of our buildings. And they're citing that it doesn't fit their needs. It's not designed to meet their needs. It's invariably, there are too many people with too many profound challenges, or it's set up with in a way that it doesn't seem to fit their needs. And I feel like a tool like this would do a lot to align, which is what we're trying to do with some of our shelter programming to get at this outreach and unsheltered question, is align outreach and unsheltered homelessness such that shelter programming is better aligned to get those folks in. I'm imagining this doing something similar rated to PSH. The whole idea behind the VAT tool is really like, how do we match the services we are investing in and deploying in our PSH with the people who need those levels of support? And that's been my biggest complaint about coordinated entry for a decade. That mismatch. It's that like everybody coming through needs a place to live, but not everybody needs 24/7 staffing, medication management, all that harm reduction stuff. That stuff is super expensive and it's hard to sustain. And if we're not matching the people who do need that with that resource, we're just missing an opportunity. And to me, this seems like a chance to pilot. How do we do a better job of aligning that stuff? And so I am all game to volunteer DSC units to say we will fill them with this tool and see what happens. And I'm fairly confident we'll see some improvement around that service matching piece, which has always been a struggle for us.
Yeah, thanks, Noah. Martha.
And I'm all for kind of figuring out a better way to prioritize. I know we've had lots and lots of conversations about this over the years, but just want to make sure we're keeping kind of the equity piece in the forefront as we're looking at different assessments. And as you mentioned earlier, Tom, like that assessments can be pretty invasive and re-traumatizing. So making sure we're also keeping that in the forefront, as well as the workload impact this has on the staff that are helping people with the CES assessments. It is very, very time consuming. I know my staff complain about that regularly, honestly. And adding additional layers on that is going to be hard for staff and for clients. It takes a lot of time. So I just want us to keep that in mind.
Yeah, thanks, Martha. Thank you for raising that. I think because our team, certainly it's helpful for more of that consistent feedback to be broadcast in these types of loops and like especially in these public spaces. And that is something that our team here hears every single day, whether regardless of what part of the response system that our team is connecting with. Folks are always kind of naming just kind of the coordinated entry data input requirements are really can feel heavy-handed and like a drain on staff's time. So I think there's certainly room for whatever direction we end up going in. And I think too, I just wanna take the chance to say that like my hope with this isn't necessarily to be kind of like, hey, this is what I think we need to do and all that. But I do think that I'm just looking forward to just putting things out there with this group and iterating and trying new things and starting to like get some of this, because it's felt like we've been stagnant for about 2 years now, and so trying to kind of help like till some of the soil and make some sorts of changes. And I think there's certainly room to say, okay, if we're having an additional assessment requirement, then we can re-examine, are there other things we can look at within the HNF and HTT and coordinated entry system program enrollment paperwork that we can reduce and cut down. Portia.
I have two different questions for you. The first is just maybe filling in the gaps for my own understanding. Could you share, like, how did you select the different vulnerability assessments that you're considering, like the VAT, the MAC, the chat? Like, what's the context for like those specific ones? And how do you plan to, like, is there going to be a rubric or assessment, or how are you choosing to identify which tools we're going to use?
Yeah, thanks for those, Portia. They're really good questions. To answer the first one, really, it's kind of like if you are researching and looking on the internet and kind of trying to find like what are alternatives that communities are using to the VI SPDAT, it's very few. There's a lot that will come up about different initiatives, like our HMIS software provider BitFocus has some stuff about how to foster and encourage conversations in communities throughout the country about how to generate and create tools that are different from the VI SPDAT, but there's not necessarily anything that has come from some of those initiatives that is already a true and existent new tool, aside from this MAP, map and chat were the only ones that I was able to find right now. Others might exist, I just have not heard of them yet. And the other piece that I'd say with that too is, or to answer your other question about kind of like framework and rubric, that's something that I'm really open to discussing with this group. Like, I think that kind of goes back to Martha's point as well. Like, how does this group want to incorporate an equity lens in examining? Because if we know that we as a community decided to remove VI SPDAT questions from our assessments because it was perpetuating racist systemic inequity in our homeless and PSH response system, certainly we're going to want to be centering that in how we are addressing to replace with anything else. I just think that the situation right now is kind of like, we had a, like, in some ways as tragic, and, you know, COVID was a pandemic, it was an awful thing. And one of the advantages that came from like a resource perspective at that time was the ability to have alternatives to even really needing to fully assess folks. And then since then, we just haven't done anything, you know, and so I think kind of trying to do something, but I'm really looking forward to working with this group to kind of say, how do we want to make these choices? So thank you.
Okay, I have one other question for you, sorry.
Yeah, go for it.
So I know some of this is going to the young adult community that we've been in conversation with, right? And the need for more referrals for the young adult community into PSH and what a gap that is. But I see in the presentation here that these would be like set aside for DESC and CCA assessors. Is that going to further reduce the young adult community's access to PSH, which is already insufficient?
Yeah, Portia, thanks for asking that. That's a really important question. I think also too, that's another thing that right now today, I think, and I have it on the agenda for technically this to be like a vote to kind of see if we want to proceed with continuing to investigate and design this pilot. I would say that certainly like any type of plan for implementation, there is no hard like plan ready for implementation right now. That's something that's going to need to be created and constructed. And you know, I think that would need to happen in partnership with, you know, like Noah's saying, with DESC, with you know, Eddie and his team at CCA, CCS. And I think that the number of units, how many units, how this is going to impact the rest of the case conferencing, you know, community. I think Jeff made a great point before too, when he was saying that, you know, the idea is not necessarily that there are units cordoned off specifically for a pre-elected group of folks. Is that, you know, there are folks who are in the coordinated entry system community queue, you know, pool already, or excuse me, not the queue, but enrolled in the program already, who would be getting assessed and then potentially matched with some of these resources. So I would say that the possibility exists that some of the youth that your programs serve or your communities and members of that, you know, work group work with could certainly, you know, have the potentially have the assessment and be service matched for any of these potential units through this type of initiative.
So you're saying like even if they weren't staying at DESC or CCA shelters, there's a chance that this pilot would allow, say, like folks to be assessed at youth care, Roots, or Friends of Youth. Like,
yeah, I think.
Okay.
I think, well, I wanna be clear. I think there's still a little too much in the air with kind of really fine tuning the planning details for how it could be implemented. So I don't wanna make a promise and go on record, but what I would say is the opportunity is certainly like, if that's a priority, then we can make sure that we're working to plan this so that it could go in that direction.
Hey, Tom, if I could just kind of add something to that really quick, and more just a response to Portia. I can at least, the impact that this would have on the YYA community, at least on the CCA side, I can tell you would actually be pretty minimal, if really any. And the reason I can say that is in our shelters, we don't have a lot of people who are under 24, and the same thing with our housing programs. If we get somebody who is like really, really young, we actually try to steer them away, and we actually ask questions around, have you tried other resources first before we bring them into our shelter programs, especially because we know the level, the acuity level of the clients there and how that could relate into them being vulnerable there. And so we really try to make sure that it's a good fit and that there's no other options first. So it would on our side, it would impact the YYA community probably very minimally.
Yeah. so-
Yeah, for sure. I agree too. Like I'm not asking for the YYA community to go to those shelters. And I think that's where I'm seeing the gap is if they're doing these pilot assessments at the adult shelters, when we already need more PSH units for YYA, are we excluding more or the possibility for YYA to get those referrals, right? Like if we're not assessing them at young adult shelters. And I know, yeah, sometimes the PSH buildings, this is a whole nother conversation. I'll end with this, but like the PSH units, like we don't have enough for the YYA community, right? And we have young adults really struggling in programs where there aren't adequate resources to support them because there isn't something that's just dedicated like YYA PSH, and it's a huge issue within our specific population. But so when I see like a pilot where they're going to be only assessing adults potentially at adult shelters, I see like the potential issue where are we going to like further restrict access to YYA for PSH?
Right.
Struggling with that. So that was
Yeah. And yes, Portia, no, it's good. Thank you. This is a great conversation. And I think, there's an element to that conversation that you're saying where I'd love to keep talking with you all as well about, even working with our, we're a work group of the COC board and kind of like elevating that exact conversation, Portia, like to the COC board as well, and kind of saying like, because one thing in that, just to bookend that conversation that I think too is, looking at the reasons why there are youths and young adults who are kind of really needing more access to like the PSH resources designed for full, adults, is that also there's needs to be more PSH resources that are kind of lower barrier designed to meet that need that there's a gap for in the community. So I think that is 100% true. And the other thing that I was going to say is to piggyback off what Eddie was saying is I see this honestly as actually really helping youths and young adults in case conferencing, because having a vulnerability assessment and a score associated with it is a helpful factor in saying like, okay, here is a person who is young, yes. However, look at their assessment and kind of see their needs in terms of being like really high needs and vulnerable. And so they do need to be prioritized for a PSH program that does have that robust offering of services. And it makes the conversation about the assessment and their needs rather than in our current system, this what seems to be at that point arbitrary length of time homeless data point, right? So it kind of like flips in that way, and it's less about how long is it, because as we know in the youth and young adult community, like it's difficult for them to have longer lengths of time for an episode of chronic homelessness because they're just younger, and youth homelessness looks different, right? And so this kind of eliminates that as a piece of the conversation and just makes it about like who this person are, that their needs and their assessment score. Noah.
Kelsey.
Oh. Well, you know what, Noah, really quick. Kelsey, I'm so sorry. I thought your hand, is this a new hand? I
It
apologize.
is a new hand.
Okay, I'm sorry. No, we'll go with Kelsey first, then you.
This is a little verging away from the current focus of the convo. But just want to flag or ask, as we are looking at assessment information and what type of tool will be asked, just want to like flag or see how we are considering around like data privacy and sharing, particularly as it relates to questions that may, in our current climate, be very sensitive. So where are we intending to be saving information? Where is that, intended to live? Thinking about how the housing needs form is built into BitFocus and to HMIS. And just wanting to think about considerations of how are we ensuring that we are not inadvertently putting information that we don't want in a database, in a database? And
Right.
how are we, ensuring that just there are those additional considerations around privacy
Yeah.
that may come up when we are doing narrative evaluation.
Mm. Yeah, thanks, Kelsey. Thank you for raising that. I mean, I certainly really important things to consider as we continue to plan. Noah.
Yeah, so just thinking about this more, I'd say, well, Martha, I thought your question about workload stuff is a really good one. Well, one thing that we've tried to do to work around that, where we had the autonomy to just determine how we were going to prioritize people for limited shelter beds, not to say it would be the same thing, of course, but like, can we really pare this down to something that is not both so intrusive, so people don't have to tell their same story over and over again to people, which is a common, very legitimate critique of these assessments, and is it something that can be done by the people who are someone who's just familiar with the person they're working with, as opposed to sitting down and going through a whole process to just shave time. We've dabbled with that. That I think there's some improvements that I would make internally here, but that all in all has been positive. So yeah, totally agree with that issue, and I've heard that too over the years about just how time consuming and intrusive these can be, and we've been trying to dabble some workarounds. But then on this other piece, like, yeah, I think it's really interesting to hear. I mean, I spend my days thinking about the single adult population. So Portia, really appreciate you bringing up youth and young adult, and just thinking about the overall continuum of people who need housing in our community. One thing that I have struggled with our approach as a community is, because the resource we can control through coordinated entry is PSH, and to a lesser degree rapid rehousing, but PSH primarily, we just like find people and move and try to get people into PSH because that's what we can control, as opposed to really trying to think about the different level of nuance and level of need individual people have in the community, and then actually matching that with the resources we actually have. And to me, this is like a little bit of a scalpel to do that on like the margins. Like this is I wouldn't imagine. I mean, Tom's talking about a pilot. I think it'd be interesting to try this. Like even amongst the continuum of PSH, there are varieties of different types of resources and programs and housing that I don't think we do a very good job of really intentionally trying to match people to. I mean, we do on the back end and we do our best, but I think this would be an effort to like really kind of align the needs of people with the services that are intentionally designed to meet those needs in a way that we really haven't done. And so like exploring that on the margins to me seems like a really good thing to dabble with. And if it doesn't work, it's a small pilot and we can pull back. But this, to me, introduces nuance and in a way the system hasn't had and is needed in a long time.
I want to be respectful of everyone's time. I think I had this on the schedule for us to talk till about 10:40. I think first, I just want to thank everybody because I think this has been a really great conversation. And I appreciate all your questions, your thoughtful questions, and the input that you brought to us today. I think maybe what I'm feeling could be a good direction for us to go with this is to ask you all if there's a group of you who's interested in partnering with me and the team here in continuing to flesh out some more of these ideas in a plan and bring in these important considerations like privacy, like how to make sure that our unsheltered populations are incorporated, et cetera. You know, these great points that you brought today, how we're going to be looking at the different tools and everything. Maybe I could just take, if those of you want to raise your hand or say that you're interested in maybe helping out with continuing to flesh out this idea over the next month, and then we can bring this discussion back to the agenda for July, and we can kind of continue to talk about it as a group and see where we're at then. Awesome. So I see Finn, Noah, Eddie, Portia, Sherry, and Martha. Great. Thank you all so much. I think that'll be let's cap it there because I think that'll be a great group.
Tom, could you restate what the decision is just to make sure that that's clear for the whole group?
Thank you, Jeff. The decision is to create kind of like a focus group to help the coordinated entry team here at KCRHA continue to flesh out this idea of some sort of, assessment tool pilot project with PSH and bring it back to the committee next month to either to present and kind of see where we are at, or decide if we want to move forward. Cool. Okay, actually, Jeff, speaking of you, you are next on our agenda here. I'll stop sharing, or do you have your slideshow pulled up, and would you like to share your screen and share? Is it okay if I just do it?
Either one is fine. I have it pulled up, but if you have it open, that's great.
We might have to like make you a co-host and stuff to share. So
Why don't you just pull it up then?
Yep.
Also, like when you do a presentation mode, like Zoom treats it funny and you can only see like yourself talking and it's really weird.
Yes. Okay, 1 second here. I'm glad I actually had it pulled up. There was a second where I didn't see the tab. It was like, do I not?
There's only 2 slides, so it's not
Yeah.
super in depth.
Okay. Okay, Jeff, take it away.
Perfect. Thanks everyone. To reintroduce myself again, my name is Jeff Sims. I use he, him pronouns. I'm the Senior Director for Policy at KCRHA. And like I said, Tom and I work together on a variety of things related to coordinated entry. I want to talk to you today about the case conferencing space that has, at KCRHA, we've often like had multiple names to refer to it, but a case conferencing space that has met in the mornings separately from like the single adult space or other case conferencing spaces. I believe that there's awareness of that across this group. It commenced in late 2022 as part of Partnership for Zero. So a lot of times you'll hear me call it like the old Partnership for Zero case conference space, even though that initiative is not actually active anymore. The operation of this case conference window or this nomination space has continued for various reasons. So you've had as like mobility transfers as we ramped down Partnership for Zero. Whoops, I see somebody else's screen, Tom.
Oh, it's here.
Thank you. Nope. There you go. Stay there. Also, like there was individuals that like also as part of that initiative, individuals coming from the downtown catchment area, which were part of Partnership for Zero overall, or other circumstances, like as Noah could talk about, as we had the navigation center closing and switching to being the Star Center, supporting some ramp down of the census there. We've had minimal recent usage of this space. But also, I think that there is an important need for something that is an emergent response from when we have a circumstance. And so that's where I want to switch to our next slide then. Which is proposing an alternative use for that space that I think doesn't match well with some of the broader intentional structures that we've set up as coordinated entry, where we have specific emergent needs. And in this case, similar to what Tom was presenting previously, I'd like to propose to this for the feedback of this group, having piloting the use of that space for when we have a shelter closure. This is a way that this window has been used. As I already mentioned, we used it a little bit with the navigation center. One of the articles on screen here is when the Lived Experience Coalition's hotel sheltering program was financially no longer viable, and we had to move people then. So there are recurrent situations that we have where a shelter is going to close, all kinds of circumstances, and there's going to be a substantial gap before that new location is available. So we have 20 beds, we're going to have 20 or 18 beds at our new location. There's going to be overlap and we can reasonably transition folks, but actually we are looking at what do we do here in an absence of shelter beds where we have individuals that we don't want to see return to homelessness. How do we make sure as a system we are approaching that with the urgency it requires to make sure that we're not further traumatizing and harming individuals? So I would like to get the feedback from this group and ideally get the endorsement of moving forward with using in a time limited way that space to adding the activation of that space. I said in June, but I should have said July. I guess June activation, but extending afterwards. For when we have some shelter programs that are closing and as I said, are not going to have a new location that's opening up soon. And then like the way we'd approach that in this case, obviously I'm coming to you all to give you some notification of its usage in that way. But I also think that this is an important thing to explore, that we come back with a formal policy that fully states some things. So when would a shelter, for example, qualify for that circumstance or not? What would be the appropriate times for this kind of an activation? How would we handle notification to this group? How would we close the use of this window for those purposes, and numerous other things that we need to explore and make sure we understand and propose. That hasn't necessarily been the degree of transparency that's been given previously, but I think it's important that we do have that and wanted to engage with this group. So with that, I'll stop and seek any kind of questions you might have and feedback, and then ideally we can move forward with whether or not the committee endorses this approach.
Zsa Zsa.
Yeah, thanks so much for that, Jeff. I'm not sure what you're saying about this case conferencing space. I'm not understanding it clearly. So if it's okay, I'm going to let Finn go, and maybe he'll bring some clarity as everybody else goes, and I'll go last. Then
Okay,
maybe
and I'm
I'll
happy to
listen.
restate it because Zsa Zsa, I doubt that it's you. I bet it's probably that I didn't do a good job
Oh
explaining
no,
it.
oh no, Jeff. Now I've been having some issues here.
All
Go
right.
ahead.
Well, I don't think
Okay.
so. I trust that I could just do a better job of phrasing that. But go ahead, Vin.
Yeah, I think it could also help to clarify that this is the space that we see in the Teams channel that's called Tap Resources right now. So it is the
Yeah,
morning
okay.
nomination space, which is the same resources that we see in the single adult sphere. We just see a smaller population having access to them in the morning.
Mhm.
My teams do use this space for that downtown catchment area. And I think one additional thing that should be considered is right now the folks using that space are self-monitoring to make sure we are not using all of the resources, to make sure that the single adult space in the afternoon has access to ample resources so we are not overusing. And I believe that is something that should be put into consideration for using the space for things in the future, because if there's 10 things in the morning and all 10 are used for a shelter closure, there's an inequity forming. So yeah, just something to consider.
Yeah, absolutely. And I think that that also gives me a good segue, Eddie, before I turn to your question, to answer Zsa Zsa's as well. That so to your point, Finn, there's units that get posted, and I do remember, Tom, you can speak to this. There's not a necessary rhyme or reason. We don't clearly have every PSH unit nominated by 9 a.m. So there's some that would post at 11 after that case conference space is already met. It's only going to be available to, well, like in theory, like it very rarely would it not be available to the single adult space. And so this morning case conference spot, this morning opportunity to nominate people without as much competition, frankly, is something that doesn't necessarily get access to every unit, but it does get an extra bite at the apple, let's say. And depending on when things come, likely could be eating up units if you're not self-regulating. And so I think that you raise a great point, Finn, which is something we need to carefully consider. That's also why I'm bringing it to this group, because what I'm essentially saying is let's say we have a shelter that is going to close and we don't have an alternative for that, and we are not able to connect them with other shelter beds. We need to do something. We don't want to just exit those people back to homelessness. This would give us a tool to support that. We might not impose the same limitations on a referral. We might eat up some of those beds. And I think it's important as a group, we recognize that's a policy decision that we're making in order to prevent harm for others, or we're saying that actually would cause more problems than it would create, than it would solve, and we need to take pause from that. So Zsa Zsa, I hope that helps a little bit in understanding what goes on. It basically is saying a designated project that is closing would have the opportunity to utilize this morning space to nominate people for housing, which gives them an extra opportunity and perhaps access to units that otherwise wouldn't come to the single adult space. Or I'm actually thinking more about the family or the youth space, things like that.
I real quick before Eddie, I see your hands up too. I just want to also kind of help clarify and contextualize, and then also too, I actually have some feedback and some ideas to contribute to the conversation that come from when I was sharing this, reviewing the agenda for our committee meeting this week with my team and talking about the assessments, both the assessments presentation and this, your presentation too, Jeff. So I think that, yes, what Jeff is saying is correct in that, it depends on the churn of kind of like when housing providers verify with my team that certain units are available on a day-to-day basis through HMIS. It's not always necessarily true. I realize I'm repeating what Jeff just said, but just to echo it, that like there's not a static amount of single adult resources that are available starting at 7 in the morning, and then the folks in this first case conferencing space get to access to some, and then it's like a guaranteed reduced number that's available to the mainstream single adult population in the afternoon. There could be like, the team is logging on and starting to reach out to housing providers and saying, hey, Eddie, are these units with the coordinated care agency actually available today? Should we post them? And then Eddie or his team might respond and say yes or no. So that point. The other thing too, Jeff, and I apologize that I actually didn't have a chance to kind of share this with you like yesterday before we were chatting here, but something that a team member of mine, an idea that our team had was to, say there are ways and there are mechanisms for, us, the CE team, to kind of highlight, like how we highlight mobility requests, for example, using our smart sheet form, to let us know that if there's an available resource and someone with a mobility request has been nominated for it, there's a way for us to see that that's the case. And then we can say, okay, according to our prioritization schema, this person is meant to take priority and get the resource. So there's mechanisms that we could say, fold in initiatives like shelter closures or like these emergency circumstances, or even the providers from the Third Avenue project, initiative itself, and kind of reincorporate that actually into the mainstream single adult space, so that it even kind of, from like a, frankly, like public relations standpoint, if you will, reduce this kind of seeming kind of like cleavage and competitiveness between the early morning time slot and the mainstream, noon to 3 single adult time slot, because I know that that's something that the community of housing navigators, whether they be outreach providers or folks working at shelters who are aware, and everyone's aware because we have to post publicly every morning saying, at 8:30 in the morning, a staff member of my team is alerting the entire Microsoft Teams coordinated entry, community, saying, here's a list of resources that are available only to a select few number of folks. I think there is something interesting about the fact that there is their own distinct and distinguished case conferencing time slot. And in some ways, it kind of is a little bit, it is both like not necessarily the whole case, but it is in another way the case that there is a distinction between the two, because in mainstream single adult case conferencing, there are local preference units. There are units that are system connected, say set aside only for folks who are enrolled in PACT programs throughout the county, and those take place during the standard case conferencing time anyways, and are only for a select few number of both outreach providers and also eligible folks. But I think kind of having it be part of the full main case conferencing time still presents with more equity. Eddie.
Hey, thank you. So I want to also Ben said a lot of what I was going to say. I mean, I'm definitely in support of that morning space, though not happening like it was, because I mean, while I appreciate Finn definitely mentioning that at least within reach, like they are kind of self-governing and making sure that they don't take all the resources, that wasn't always the case. Especially when it was PFZ there, like there were many times when there would be a list of like 10 different resources that were there, and then the single adult space, there would be like nothing there, or like 1 or 2, or it would just be the SROs that were left and no studios at all. That was the biggest thing that I always saw. It was like, sure, that they weren't all gone, but anything that would be considered better than an SRO was gone. And so I definitely would support like not having that morning space be for that select group anymore. But I also really like the idea of still putting some additional guardrails and framework around it and being able to spin it up for when like those shelter closures are happening, or there's some type of an emergent need that really is. But I think, Jeff, kind of like what you said, we need to kind of set up some really clear guidelines and boundaries around what that emergent need is and what would trigger that kind of spin up. So it's because that was the other thing when that space was spun up originally. Like, yes, a lot of us know about it now, but it was not widely known about it when it was started. And it was very like once people found out, like people in the community got really upset, like especially providers, that there was this whole nother thing that was happening where that's why nobody in their shelters or in their outreach programs were able to access these resources because they were all getting snapped up in the morning is how they felt. Not sure, not saying that that's reality, but that's just the impression and feelings that they got. So I think the more that we can do to be transparent around this and what's going to happen, the better. And making sure that, again, a very clear guardrails around it.
Yeah, I couldn't agree with more with everything you said, Eddie. And I think that that's actually why I'm intentionally coming to this group and saying, let's talk about this and make sure as a group we recognize this as an appropriate approach here. I think, Tom, you're raising some other alternatives we might have as pathways, which is why I think it's important to think about like this is a test, just like with our prior conversation about, there could be things that arise with this. We're going to come back and say, unintended consequence was worse than the solve. And so like let's not do this anymore and keep going a different route. But I think that I don't want to see us stagnating as a system. I think we need to like recognize there's some things we need to be taking steps to really address urgent needs and like also innovating to make our coordinated entry systems really responsive to those and operating efficiently, also operating equitably. So.
Yeah, thank you, Jeff. I also think too, like short term, we're talking about this, and then like longer term, actually, this conversation is reminding me of a conversation I've had with Elliot in the past about other types of emergent needs that come up too. So I think, for example, like Plymouth Housing does not operate any shelter programs or short-term housing programs, only permanent supportive housing. When they have, water damage or emergent situations where they're needing to like relocate folks, other providers like DESC or CCA, CCS, for example, are able to say, okay, the '08 stack of a certain building has all been damaged from a fire. We have a need to relocate 15 households at a time. We have shelter beds that we can leverage or like a large, PSH portfolio with vacant units that we can leverage to kind of relocate some of those folks. And I know Elliot, not to speak for you, but I just know that in the past you've mentioned with Plymouth, like you don't always have that same flexibility and kind of wanting to have a conversation with this group too about kind of like, what are ideas that we could, do to solve about that? So Jeff, I see this conversation as certainly one that, and this step, like you're saying, kind of trying to iterate at least something, taking us out of some like stagnation and getting some good conversation going about ways that we can think of these issues.
I think there's somebody in the Q&A that has their hand up.
Oh, okay.
Okay. Tom, I just want to, like, and I saw Elliot, you're nodding there. Yeah, I think that I don't want to say that this would be the only use, but I also recognize the potential for snowballing in any kind of approach here. So like I want to be clear, like testing out in a certain way initially, and then KCRHA coming back with a full policy then of like, this is our proposal, and let's formally go through that as an update to our coordinated entry systems, policies, and procedures on how we would handle these kinds of things.
I'm gonna call on Zsa Zsa, and then Leah has joined us, and Leah had her hand up too. So Zsa Zsa, we'll turn to you first and then go to Leah after.
Go ahead and go to Leah. My question was, do we save other shelter beds that are like saved for this purpose? You know what I mean?
Which purpose?
For the purpose of a mishap, or an emergency.
No, we never have a bank of shelter beds
That's
for
what I was
anything on
wondering.
standby.
Thank you, Jeff. That's my question.
And that's really the reason I think that you're driving exactly what the concern is. If we had a system with the kind of slack in it that there's a fire and something has to close and we're not going to have a solution for it. Or there's a program that's going to close and we haven't been able to successfully launch its successor. And we have a bunch of individuals who are looking at losing shelter and being unsheltered homelessness again. We don't have the kind of slack on our system to solve this. So that's why we need to, that's why I'm bringing this conversation to this group. Ideally, we'll one day get to a spot where we have that kind of capacity and we have a more responsive system. That's just not the case.
Thanks, Jeff. Leah, I'm going to ask you to unmute. I saw that your hand was up. I don't know if there was something that you wanted to contribute to the conversation as well.
No, it was entirely accidental. Apologies.
Well, either way, hello, welcome. Good to see you. Okay. Great. I think, Jeff, I don't know if you want to kind of ask, or if there's someone who would like to make a motion to say, is it something that would like to move forward in doing? And then I also think too, definitely a lot of really excellent questions that you all have raised today. And I think pointing to a longer term, conversation about even if this type of idea that Jeff has for us today right now isn't the end of the road of where we want to be in this conversation, definitely the door is open to continuing it.
Tom, this is Zsa Zsa. When Jeff was talking about that, that was my understanding of what he just clarified at the end, that there isn't that space available. So let's figure out how we can make that space available. So I would like to make a motion that we use this as a pilot, you know what I mean? Just to an introduction, nothing written in stone, but just an introduction to see where it could go. That's my motion.
Yeah, I think too, just to make sure that we're all on the same page and clear too, is that the extra beds in case of emergency, those are not what exists. But and also what doesn't yet exist too is Jeff's idea is not something that would create those extra beds, but rather just make sure that people who are in need of them at the time are getting access to them.
Right, that is my understanding, that
Okay.
there would be a priority tool, you know what I mean? Yes.
So could you restate the motion that you're making, Zsa Zsa? Introduction to pilot.
Introduction to case conferencing pilot tool. Priority, how would you say that, Jeff?
Yeah, I think that you're essentially making the motion to test the use of our morning case conference space for emergent circumstances when there's going to be a shelter closure that doesn't have alternative beds.
The emergent needs
That's
case
a
conference
long-
space.
Yeah, emergent needs case conference.
That's a long enough.
Catherine, make that sound nice.
Yeah,
Yeah.
and short.
Motion to approve emergent needs case conference space.
Okay, motion to approve.
Emergent need case conferencing
Emergent needs case
space.
conference space.
Thank you, Tom. Short and sweet.
Okay,
I second it. I think I can say that right.
Sherry, thank you, Sherry. And we'll do a voice vote. So all those in favor, say aye.
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 Those opposed?
Aye.
Any further discussion? The ayes have it, approved.
Awesome. Thanks, everybody. And thank you, Jeff. Yeah, thanks, Jeff, for bringing the idea and coming to talk with us about it today. So nice to have you. Okay, let's see. The last thing that we have on our agenda today is to discuss and vote on. Sorry, hold on, stop share.
Actually, you need to approve the May meeting first.
Thank you. Catherine reminded me, we forgot to vote on approving the meeting minutes from, it's
From May.
from May.
Correct.
And so actually, I'll turn it over to Catherine to kind of take us through this process here.
We need a motion, please, to approve May's minutes.
I move to approve the May minutes.
I
I'll
second.
second it.
Oh,
Who was the second?
Eddie.
Eddie, thank you. And again, we can do a voice vote. So all those in favor of approving May's meeting minutes, please say yay.
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 Hey.
Those opposed? Any discussion? The yeas have it. Approved.
Wonderful. Thank you, Catherine. The last thing that we have on our agenda is to have a discussion about and elect a co-chair for the Coordinated Entry Committee. So according to our Coordinated Entry System policies and procedures, the Coordinated Entry Committee bylaws and the COC charter, Coordinated Entry Committee is meant to have a co-chair who works in partnership with myself. So I'm the KCRHA, coordinating entity staffing member of the Coordinated Entry Committee, but I am not, chair or co-chair of the Coordinated Entry Committee. And so it's intended for us to have a co-chair. The co-chair, according to our policies and procedures, is meant to be one of the members of the committee from our Continuum of Care board. We have 2 members from the Continuum of Care board who are members of our Coordinated Entry Committee. Those are Dr. Patricia Barnes-Sam, as well as Zsa Zsa Floyd. And so today I was hoping to talk with you all about electing a co-chair, and then seeing if there is anyone who would like to nominate someone for our co-chair position and vote. And I'd say I think this is a great topic, and I would love to partner with the co-chair for to work with myself and Catherine on creating the agendas, communicating with you all, and kind of just continuing to really deepen and support the great work that we've all been doing together. So Zsa Zsa, your hand's up. I'll turn it over to you.
Yeah, Tom. So when you say co-chair, when I think of co-chair, I think of 2 people being chair. One person, not a single chair,
Sure.
but a co-chair being 2. So is that not how it works, or?
How does System Performance Committee do it?
System
Do they have-
Performance Committee has 2 co-chairs.
You would have a chair. The chair would be your partner.
Okay.
I want to flag for everyone's awareness that the existing COC charter does not consistently use language in each
Your
committee.
bylaws.
And then there's also bylaws for this committee. So there's that, you're totally right, Zsa Zsa, to be like, this is a weird thing. And also the treatment of when someone in Tom's role is a chair or co-chair, it is not even the same words used frequently. And so there's a little bit of uncertainty about some things here. I will seek to pull, sorry, I wasn't planning on chiming in at this point, but I will grab the COC charter and pull that up if it's helpful. But you're right that there's a little confusion about what our roles, and the revision committee is trying to fix it.
In your bylaws.
Yeah, it's in our bylaws. I think too. I can pull those up quickly as well. And then the only thing that I would just add to what Jeff is saying there is that, I'm like deeply grateful for the support that Catherine gives and kind of the facilitation, like voting and the logistical and like Zoom support for the meeting too. And then, really want to shout out Kelsey for helping as well with some of the kind of like parliamentary procedures here. And also too, I would just say that whether it's 1 or 2, I mean, I think having, support just for me and kind of like the agenda creation and kind of helping forecast, for the rest of the year, like what are the types of things that we'd like to keep talking about. I would love to have that as well. So Jeff, is this a new hand that you have up?
It is. I just wanted to read the charter language to
Great.
make sure people understand what's going on here. So in some cases, things are really clearly stated. Sometimes it's like staffed and chaired or shall serve as. With the coordinated entry committee, it just says it's staffed by the manager of the appropriate office. Members include that staff, providers and customers with with expertise in this area. The CE committee oversees policies and procedures related to coordinated entry. So Tom is a member, and staffs it. But whereas in other committees it says like Tom is a chair because he's the staffer, that's not clearly articulated here. And then do you have the bylaws available, Catherine? I didn't get that up yet.
Tom, I think Tom pulled up the bylaws.
I have it right here. So, where do I want to start reading? Okay, the CEC will have a leadership structure consisting of one chairperson who is a member of the COC board. The individual occupying the chair position will be responsible for agenda co-creation, facilitating the CEC meetings, and reporting back progress and decisions to the COC board. All of these activities will be in partnership with and supported by KCRHA staff. So that's what it says in our committee's bylaws. And back to you, Jeff. I don't know if that's another new old hand.
Thanks for the clarity. Tom, I was just confused on that co-chair thing, but it makes sense when you're already the staff. You know, I mean, you just need somebody alongside you. And I just want to say for the record, I'm available. And that's what another thing I was going to ask, if Dr. Sam and I both, I mean, if we want to be in that role, and I do. So I don't know what Dr. Sam.
Dr. Sam.
Yeah, Dr. Sam, your hand's up. Go for it.
Good morning, everyone. I'm on the KCR, the website. Are the bylaws that you're reading, are they attached inside the, I was looking for them so I could follow along with you. Are they under on the website?
Are the bylaws on KCRHA's website?
I don't know.
Yeah, are they? That's one question. Because I'm on the website and I was looking, if so, could someone direct me where to find the bylaws?
Yeah, I'd have to look, Dr. Sam, but I'm checking right now. They might, yeah, they might
Are
be,
you able to
honestly,
share the bylaws with this whole group?
Yeah.
Awesome. Thank you.
And yes, Finn, I am.
And Dr. Sam, can I ask you if you are also interested and available to be the chair, co-chair or whatever? Because that's what we need to get out first. Are we both interested? And that's great. You know what I mean? Just so people have an idea of who wants to and who doesn't, or. Yeah.
Can you all hear me okay?
Yes, ma'am.
So I'm interested. It would be nice. Thanks for whoever put my name in. I would like to know more about the hours and the responsibility and the time. And that's because I do work a day job and I just need to know what, so that if I make a commitment, I'd like to be able to follow through and know that I can fully participate. So that's my ask. Is for more information on the responsibilities, the time, and is it in person we will meet? Is it evening hours? How does that work?
Yeah, thank you, Dr. Sam. Those are all great questions. And certainly like the types of things that whatever the result today, would certainly kind of talk about and, figure out together whatever's most convenient for us both. But would someone now like to make a motion to nominate a co-chair for the coordinated entry committee?
Tom, before we do that, can you answer Patricia's question so she's clear on the time commitment and the hours? And I see Kelsey probably has that information.
Yep, I'm happy to share. And Tom, add anything that may differ from what I say. From other committees and work groups, The typical kind of responsibilities and time allocation is about an additional hour and a half to 2 hours a month. Typically meeting a week or two before this regular scheduled meeting. And there may also be a time to do like a debrief around the meeting. To identify, what are some things that were left lingering, questions to follow up on, what are next steps, and then agenda planning and preparation for that upcoming meeting. So typically you'll see like an additional, I would say 2 hours a month.
I think I might only need one of your 1 hour of your time a month.
That's doable for me. Thank you.
And I also think too, my element or my thing in this conversation too is even having 1 hour of either of your time a month would be very helpful to me.
Okay, great.
So, that's, yeah, does that help?
Yes, very much clarifies. Awesome. So I will say yes.
So we need a motion for a nomination.
Martha,
Move to nominate Zsa Zsa.
is there anyone who would like to second Martha's nomination?
I will, but also I was wondering, do we need to do these one at a time, or can we just say do both of them at the same time?
We should,
When we're voting on one, we only need one co-chair.
Oh, gotcha.
Is what our bylaws say, one co-chair.
Okay. I will second Martha.
and for this, I'll do a roll call vote. So for Devin, the proxy chair, Ann?
Yes.
Okay. Noah,
Yes.
Eddie,
Yes.
Martha,
Yes.
Portia,
Yes.
Dr. Sam,
Yes.
Elliot,
Yes.
Kelsey,
Yes.
Sherry,
Yes.
Finn,
Yes.
and Mustafa.
Yes.
That is an overwhelming yes, and congratulations, Zsa Zsa. You're now the CEC chair?
Co-chair.
Co-chair.
Yeah, chair.
Chair,
Yeah.
co-chair.
Yeah, congratulations, Zsa Zsa.
Thank you all so very much. I was wondering how that was gonna go because with Dr. I'm so excited to represent and to be in that space. But I was just wondering how the voting was, if it was like all of our other votes where if one person gets it in, then you don't go to the next person thing. Right?
So the nomination was made for you.
Oh,
And you
okay.
received-
But
and you
I know,
received
but
the-
I thought we do a nomination for me and then second, right? And then is there any other nominations? And then, you know, what I mean, that's what, that's all. I'm excited, to be in that space, but I just want to be fair. That's all.
We absolutely can do that, Zsa Zsa. Would you like to nominate?
I would have nominated Patricia, but I mean, since we're already done, I mean, is that how it goes? Just answer that question.
Well, you did receive 11 votes.
Okay,
so
I know, but
if-
I'm saying is the process, nominate someone, and then someone seconds it, and then is there any other nominations? I just want to know if that's the process. I don't want anyone to be.
If there was more than one position, then we would have done more than.
Oh,
one
okay,
vote.
I got you.
There's
I
only
got you.
one
It's based on the position.
available.
Yeah, because when Tom answered, Eddie's question, that was what my uncertainty, I wasn't clear on that. So thank you.
You're welcome.
Yeah,
Anyway, I don't want to sound like I don't want to be it because I do, but I'm just saying, I just also want to be fair.
yeah,
to
of
the
course, of
process,
course. No, I
right?
appreciate your mind
Because
on that.
integrity
Fair.
and honesty is everything to me,
100%.
so.
Yes, agreed. Yeah, well, congratulations, Zsa Zsa. Everyone, thank you so much. I'm really grateful for the conversations today and feeling like we're kind of really finally starting to get some like wheels turning here on this group coming together to kind of continue to make change and work toward the continuous improvement of our coordinated entry system. So I'm really grateful to you all, and I look forward to working with Zsa Zsa to prepare an agenda for you all next month. Catherine and I will work to get these meeting minutes sent out to you. And yeah, just looking forward to our July meeting. So thank you all very much. Martha.
Our little subgroup that's meeting.
Oh,
Do we have someone that's going to organize a meeting?
yes.
I got the names down.
Catherine has the names
Awesome,
recorded.
thank you.
Yeah, Catherine has the names recorded and I'll reach out to you all. So we'll continue that conversation too. Important. Thanks, Martha. Okay. Unless anyone else has anything, I think we're all set to adjourn. So any other last comments for the good of the committee? No.
Thanks,
Have a
everybody.
good day, everybody. Bye.
Nice day.
All right. Thank you. Bye.
Bye, everyone.